Hello, I am so happy to speak to young Russian doctor about prolapsus and incontinence, because now we have the proof, the bibliographic proof. It is better to cure prolapse in the first time. What is the definition of the prolapse? The prolapse is a POPQ definition. It's stage 3 or 4 prolapse. And for stage 2, usually we not need the surgery, but for stage 3 and 4, if the patient have prolapse and incontinence, firstly, it's better, the best is to cure the prolapse, inform the patients about the future of the incontinence after the outcome of the incontinence after the surgery. I will show you 4 publications that formally demonstrate this way. First of all, we have the guidelines, the European guidelines of 2023 do not offer concomitant anti-incontinence surgery at the time of abdominal prolapse surgery. It's a strong recommendations. I invite you to read the different publications to do these conclusions, because it's really demonstrative. And inform women of the increased risk of adverse event with combined prolapse and anterior incontinence surgery compared to prolapse surgery alone. What is the risk? The main risk of this surgery is how we manage voiding dysfunctions just after surgery. If it is avoiding dysfunctions because the tape is more adjusted beyond the urethra, we have to relax the tape by second surgery during the 8 days after surgery, between 5 and 10 days after surgery. More than 10 days, it's impossible to move the tape easily. If it is avoiding dysfunctions, consequence of the prolapse surgery, just we have to wait. And when the bladder work well, and the inflammations and the surgery traumatism disappear, the bladder will work normally, and the majority of the patients with no second time surgery will have a good outcome with the voiding dysfunctions. That's the main problem we can have as complications if we do in the same time tape and prolapse surgery. If we look now the publications, the first publication is about the adverse event directly related to surgery. POP surgery plus tape in the same time, 28% more voiding dysfunctions. POP surgery alone, only 15% of voiding dysfunctions. Okay? You have to read it. That's a very important publication. The second publication, it compares the use of mus at initial POP surgery to POP surgery alone with 12-month follow-up. 44% of the women without initial mus never require surgery, and 30% were dry. The cure of the prolapse is in between 1/3 and half of the case, the treatment for the incontinence. And if we do in the same time the cure of the incontinence by tape and the cure of the prolapse, the risk is to propose to the patients a treatment the patient don't need, but we increase a lot the risk of complications and difficult management of the difficult management of the voiding dysfunctions after this double surgery. And this last publication is the publications, the French publication of Fritel. It's the Vigimesh registry, approximately 2,000 patients with complications. And this curve is very interesting. We have here 8 months, the follow-up of all these patients. And in blue, it is the sacrocolpopexy alone. In gray, the vaginal native surgery for prolapse alone. And in red, the MUS complications. And in green, it is the patient within the same time POP surgery plus sling, TUT or retropubic tape. And you can see if we have only sacrocolpopexy or native surgery, we have low risk of complications. If we mixed this both surgery with tapes in the same time, we increase the risk by 4 or 5 to have complications. More the curve is down, more it is the percentage of complication. I hope with this bibliography demonstrate for you to cure incontinence by sling and prolapse in the same time is absolutely not the good way. Thank you for your attention.